Here's another cautionary tale that I'm sure Dr. Dan Edney would join me on. Good morning, sir. How are you?
Good morning. I'm well. How are you?
I'm doing good. Do not take lightning for granted.
No.
Especially in this, because it's one of those things, if you see the hair stand up on your arm, it may be too late. So yesterday was a lightning show. I mean, just seemed like every 4 or 5 seconds, there was a boomer coming close. I thought, well, it's going to be frying some electronics very soon, but that wasn't good. How are you, sir?
I'm doing well. Thank you. Hope you are.
Thank you for coming in. I appreciate it so very much. I know you're a busy guy. I do want to mention this, though, and if anybody has any questions on this bacteria stuff, certainly you can zip me a quick question on C Spire text line, 601-879-4395.
Yeah, I heard you talking about this earlier this week. I said he'll be calling.
Yes. Well, we've known each other too long now. I think well, when you think I'm talking about you, just call me first. We can cut the time period down. But no, thank you for coming on.
My pleasure.
Tell me what we should know about this. And we're talking about, for folks who don't know what I'm talking about, was a lot of alerts that came out about and I guess it's both soil and water, but he'll clear this up in a moment or two, some bacteria that's rather dangerous, rather rare, and it does affect not only our SuperTalk family all across the coast now, but also people who are deciding to, pack up and go on vacation to the coast.
Yeah, this is a new emerging bacteria called Burkholderia pseudomallei. It causes, say that 3 times fast. It has.
I can't say it one time slow.
It causes pneumonia, very similar to tuberculosis.
Wow.
But it's not tuberculosis. It's a totally different type organism. But it's an environmental organism that does cross over and to infect humans. And just our luck in Mississippi Health Department style, there have been 3 cases on the Mississippi Gulf Coast over the last 3 years, and they're the first 3 cases in North America. So this is a new organism entering our continent, and, of course, it chooses Mississippi to enter. The 3 cases all survived, although one was very sick. One individual not only had pneumonia but had septicemia from it, but survived, thankfully. So as you said, it is rare, but it's emerging. And, the main reason I was happy to come talk about it when you reached out to me was to reassure folks that, it is okay. There's some simple precautions to take from it, but also just to remind everybody the importance of public health. This is what we do. We monitor these emerging infections so everybody else doesn't have to worry about it, and we alert the medical community when we see these things and then educate them on how to manage it. But the precautions to take are fairly simple. This is a freshwater organism, so on the coast we're talking about more along rivers, creeks, or more than brackish water. And
wait, would it survive also in brackish water?
The lower the salinity, the more likely it will survive.
Okay.
So
all right. So it could be on the beach. Let's say the beaches of the Gulf Coast.
Yeah. So the 3 individuals who contracted it all were working, in gardens or working in the soil, and it was after times of high rain, so the soil was very wet. So we're just asking folks on the coast, as you're gardening or you're working in water or soil, especially wet soil, that you wear gloves and make sure you're covering any cuts or abrasions on your hands. You're not going to inhale it and get it. You're going to get it through working your hands in the soil or being barefoot in the soil.
Mostly through a wound, or could it come through other than that?
It is typically going to come through a break in the skin. So it could be, a simple abrasion could let it in.
What would other than taking a bath? I mean, would you put any, if you have an open wound, even though you've had it covered, come back in and put something else on it, some antiseptic or something?
Well, just wash thoroughly with soap and water, and then keep the gloves clean that you're doing your gardening in, and you periodically change them out. Keep some inexpensive gloves that you can change out, but do wear gloves as you're working in the soil this summer.
I would imagine somewhere some diluted Clorox or some type of bleach may help out.
Yeah, even Dawn dishwater soap will get it.
Are the symptoms different in some way where you might think, okay, I've been working out in the soil, I've been working or doing a little swimming or whatever, and I'm beginning to feel ill. Do they differentiate between just a normal cold or something? Can you tell that?
Well, it's going to be a lower respiratory infection like pneumonia. So it's going to be shortness of breath, deep cough, sputum production, fever. And, as physicians are evaluating what type of pneumonia, the cultures should identify the organism.
Is the protocol for treating regular pneumonia or just regular flu, would that help it?
Once the labs identify the organism, then we're going to test it to see, what medicines will be most effective to help guide the physicians. And this is why the public health lab that on our main campus in Jackson is so very important. It has the capacity to do this specific type testing.
Do you have any idea where this came from? Is it like South America or?
Yeah, probably came up from Central South America, and whether it entered, we get a lot of things that come in on boats, or whether a person brought it in, we don't know. But again, it's an environmental bug, so it had to go from the soil down there to our soil.
The state health officer.
It's not anywhere else in the state, though, just on the
coast. That was my next question to the state health officer, Dr. Dan Edney. Is your alarm button maybe not clicking off that much because we've only had 3 cases and it hasn't gone further north?
Right. 3 cases in 3 years. So it's not escalating, and we did do a partnership evaluation with CDC to really look at the epidemiology, and it was reassuring to us. We'll continue to monitor it and make sure that the medical community is aware of any changes.
No similarities or no connection whatsoever to the seaweed bacteria that we were talking about in Florida, too?
No, it's a different organism.
This is different. Well, we have enough of that, so it's just as safe to be in Florida as it is in Mississippi than Florida.
I don't know. There's a black bear in Destin swimming in the surf.
Oh, geez. Did you see the video of the sharks at Orange Beach?
That's crazy.
I mean, it is just absolutely crazy it was like 5 or 6 of them. I will say this, and somebody asked me about this yesterday. I said there were some pretty heavy people who normally can't get up on a pontoon that fast out of the water, but I think they set records. While I got you in here, could we get an update on as far as COVID's concerned and where we are with this?
Yeah, COVID is COVID. It's just percolating along. Thankfully, the numbers are staying low. I just wish we could eliminate the deaths. We still, we'll have 1 to 3 deaths per week statewide. We're well over 13,000 deaths since the beginning of the pandemic. It's still an Omicron variant that thankfully is not mutating. Natural infection is previous natural infections given pretty good immunity. The vaccine has given excellent immunity. So pretty much where we've been the last 4 months.
Are you optimistic that we haven't seen another variety of that, another variant of that pop up? At least it's been a while.
Paul,
knock on wood. Maybe you shouldn't say that. You jinx it.
I definitely don't want to jinx this. And I've seen this bug throw us curveballs at the craziest ways at the craziest times. So
I got to ask you about flu too. Can we do that when we come back?
Sure, absolutely.
All right, back with more. Dr. Dan Edney, State Health Officer. We welcome him to visit as Mayor Carolyn McAdams from Greenwood. We had another Mississippi Trail Marker Award unveiled yesterday in Greenwood. We'll talk about that coming up at 8:37. Back with more next. Local C Spire store. Back with Dr. Dan Edney, State Health Officer. Flu, where are we there, sir?
We're okay. It's a good bit early for flu. We always see some sporadic cases, but nothing of concern. We've not been alerted yet of any issues in the Southern Hemisphere. The Southern Hemisphere gives us a guide of what we can expect when our flu season hits. And so far, we're not hearing anything alarming.
Any new laws that roll in from the 2023 session that affect the Department of Health when it starts July 1st, a couple of weeks from now?
Yes, we're responsible for administering the hospital sustainability grant that the legislature passed, $103 million that's going out to hospitals, and the Board of Health has adopted the regulations that we promulgated to enact and administer that grant. Understand that's ARPA funding. The Department of Finance and Administration has a lot to do with controlling those dollars, and we've gotten pretty much our marching orders of what the federal government will let us do with it, and we're working to accept applications now and try to get that money out as quickly as we can.
I'm sure you heard the administrator from the Winston Hospital was on the air with me saying that he didn't call it bogus, of course. He just said that there are so many things that you can or cannot do, and that a lot of people are not going to be able to qualify for this. What's your statement on that as far as the $104 million?
Well, and I actually gave Mr. Black a call after I heard his interview. It was actually quite a good interview, and he was spot on, except I think he's being overly pessimistic about how hospitals are going to benefit from this. Everybody was just expecting a check to be written and mailed, and the federal government is federal money. That's not how they roll. So but what we have done is to evaluate what will be allowed and to make sure all the hospital administrators know that. We've got a FAQ list on our website to say these are generally acceptable expenses that we can reimburse for, but we first of all you have to demonstrate that you had losses in COVID, and if you did not have losses in COVID, I want to know what your business model is. It's pretty strong. And then if you have expenses from COVID that have not been reimbursed by other programs, then we can reimburse that. And the first few applications we're getting, it's looking like they're going to qualify for the maximum. So I'm optimistic we'll be able to help a lot of the hospitals.
What's the timeline on this for them to get all the information in? Well,
there's no set timeline. The application period is open. They have until the money's gone.
And just to make sure that I understand this ultimately is in grant form, not in loan form.
This is grant money.
This would be grant money.
Right.
Because there were some questions about that also, yeah.
So it's reimbursable. It's not just they qualify and they get a check. They have to show us that they had expenses, and we reimburse those expenses out of the grant.
There are so many things going on as far as the hospitals. I know it's another thing that's added on your plate there, but any statement as far as the state health officer and where we are with the hospitals in general across the state?
Well, certainly the hospitals in the Delta continue to struggle mightily. I've been in conversations with 5 hospitals that are moving towards downgrading to the Rural Emergency Hospital News designation, which is where they give up inpatient services and provide full-service emergency department, outpatient services, can keep a patient for 23 hours of observation and then have to transfer if they can't go home. And in exchange, the CMS, basically Medicare, Medicaid, will give them a $3 million bonus per year to be at that designation. So that's quite tempting for a lot of the hospitals that are smaller and struggling as a path to survivability.
I think it was last week when I was off, I read a story rather in-depth about how the whole nature of the small rural hospitals are changing, not only here, but in certainly in the South. I think Texas, and there was another state, maybe it was Kansas, but we're not the only ones suffering. There is a socioeconomic change, and I'm sure the people in the industry are meeting, trying to form some type of a plan here.
And the market's making that happen. The days of having a full-service hospital in every county are over. That's not financially sustainable, and the current revenue stream.
It would be something like my father would tell us: you do what you do best, and don't do a lot of things bad.
That's right.
And I think that's probably the model that we're going to have to look at in the future. It is always a pleasure, sir. Thank you for taking the time.
Thank you so much. Always
glad
to be
Dr.
here.
Dan.